Dear gentlemen, if you care about men's health after the age of 50, especially your sexual function, confidence, and quality of life, then this is the video you shouldn't skip. I'm Dr. Marie, and I've accompanied many men in their journey to naturally and safely restore sexual wellness. And today we'll explore 10 common mistakes that men often unknowingly make with their private area. And more importantly, many of these mistakes can lead to serious consequences if not recognized in time. Some things in today's list might make you chuckle, while others could send a chill down your spine when you realize, I've done that too. But either way, every point is a valuable lesson drawn from my real-life experience in examining and treating male patients. In particular, in the first part of this video, I'll share a very important sign that often appears in the genital area. Yet most men overlook it, even though it could be an early indicator of a much more serious health issue happening inside the body. But before we dive into the main content, may I ask you something? Where are you watching this video from? Please share your city or country in the comments section below. I'd be truly happy to know who I'm walking alongside on today's journey. And if this is your first time visiting the channel, don't hesitate to click subscribe and turn on the notification bell so you won't miss future helpful videos on men's health, vitality, and aging well. Now, let's begin with the first thing every man needs to clearly understand when it comes to genital health. 1. Don't ignore unusual signs in the private area. They could be early warnings of deeper health issues. Many people don't realize that the penis can actually reflect your overall health, but medically speaking, that's absolutely valid. During my clinical practice, I've seen many cases of erectile dysfunction where after further tests, the patient was found to be in the early stages of cardiovascular disease or metabolic disorders. The reason is this: the blood vessels in the penis are extremely small and sensitive to changes in circulation. When blood flow is impaired due to atherosclerosis or irregular blood pressure, the penis is often the first place to show symptoms, not the heart or brain. Signs like reduced frequency of spontaneous morning erections, a weaker feeling during intimacy, or difficulty maintaining an erection can all be early indicators of vascular, neurological, or hormonal dysfunction. The key point is, don't be complacent. Small changes, if observed in time, can help detect and correct a health problem much earlier. The body is always sending signals. The real question is, are we listening? In the next part, I'll talk about a regrettable mistake that many men are still quietly making: self-applying internet tips to fix sexual function, which sometimes results in irreversible damage. Dear friend, if you're still watching the video up to this point, I truly appreciate your attention to your health. Please leave a number 1 in the comments below to let me know you're still with me. Number 2. Stay away from internet hacks and homemade devices. Hidden risks that can destroy male sexual function. In my many years of working with male patients, I've handled countless emergency cases that stemmed from so-called self-improvement methods found online. Some men applied apple cider vinegar directly onto their penis, hoping to make it bigger and stronger. Others created their own stretching devices using plastic bottles, rubber bands, or even metal bolts, only to end up in the hospital with severe swelling, and in some cases, even tissue necrosis. One technique that frequently appears on online forums is jelqing, manually stretching the penis in hopes of increasing length. But medically speaking, this method poses serious risks of damaging the tiny blood vessels in the erectile tissue, which may lead to scarring and permanent erectile dysfunction. I've treated many young patients who suffered lasting damage simply because they trusted unverified tips with no scientific basis. One of the most dangerous practices involves DIY constriction rings. If they can't be removed in time, blood cannot flow back properly, resulting in tissue necrosis. Some cases required specialized medical tools, and worse, surgical intervention to save sexual function. If you truly need help with erection support, always look for medically approved devices that are certified for safety and easy to remove. And most importantly, consult your doctor before using any tool or method that directly affects your genital area. Now let's revisit something that seems simple and that most people think they're doing right. Daily genital hygiene. But if done incorrectly, it can lead to chronic infections and even increase the risk of more serious health problems. 3. Proper hygiene for the sensitive area. A small habit with a big health impact. It may sound simple, but the truth is, many men still clean their private area the wrong way, especially those who haven't been circumcised. When hygiene is not done thoroughly, substances like sweat, dead skin cells, and natural oils accumulate and form a substance called smegma, which creates the perfect environment for bacteria to thrive and cause infections. If you have a foreskin, always remember to gently pull it back, clean the inner part using warm water or a mild, fragrance-free cleanser, and dry it completely before getting dressed. Moisture buildup in this area can lead to irritation, skin fungal infections, and over time, even phimosis or difficulty cleaning properly in the future. Another common mistake is being too clean. When you scrub too hard or use strong soaps with harsh chemicals, the skin in the genital area can become damaged, dry, or irritated, and it may disrupt the balance of good bacteria. Proper hygiene means gentle cleaning, no harsh rubbing, and no need for scented soaps or sprays. Another important habit is to routinely inspect the skin around the foreskin. Catching early changes like discoloration, ulcers, or thickened patches can help detect rare but dangerous conditions like penile cancer in time. To continue our journey, I'll point out some early warning signs in the genital area that many men might be ignoring, from pain while urinating to unusual bleeding, all of which can be the first signs of a more serious underlying health problem. If you're still watching this video at this point, thank you for staying with me. I truly appreciate your presence. Please leave the number 3 in the comments so I know you're still here walking this journey with me. Number 4. Unusual symptoms in the private area. Small signs that could mean something big. You may have experienced a burning sensation during intercourse, discomfort while urinating, or noticed ulcers, strange spots, or even blood in your urine. Even if these symptoms seem to come and go quickly, never ignore them. These seemingly minor issues can sometimes be the early signs of serious conditions like urinary tract infections, sexually transmitted diseases, urethral stones, or in rare cases, early signs of bladder cancer or penile cancer. I understand that many men stay silent out of embarrassment, hoping the problem will just go away. But delaying action not only allows the condition to quietly progress, it also makes future treatment more complicated. If you feel dismissed or not taken seriously during a checkup, don't hesitate to seek out another doctor. You deserve care in an environment that is respectful and non-judgmental. Early detection is always key to successful treatment, not just for cancer, but for most male health issues in general. Don't let shyness cost you your future health. Up next, I'll share a risk that very few people expect, yet it happens more often than you think. Injury caused by lack of control during sex. It may sound unbelievable, but if you've ever heard of a penile fracture, you'll understand why this next part is so important. 5. Safe sex controlled movement, a man's secret to protecting his health and confidence. A confident man doesn't just show it in his performance, but also in how he protects himself and his partner during intimate moments. Using protection like condoms isn't just about preventing sexually transmitted infections. It also brings peace of mind, allowing both partners to feel more relaxed and connected. But the idea of safe sex goes beyond disease prevention. One often overlooked factor is controlling your movement and positioning during sex. A penile fracture, it might sound strange, is actually a real medical emergency. I, along with many of my colleagues in urology, have treated cases like this. When the penis is fully erect, a sudden bend, caused by impact or incorrect position, can lead to a snapping sound, followed by intense pain, swelling, and deformation. It's often described by patients as the eggplant deformity. This condition requires urgent surgery to prevent permanent damage, including the risk of lifelong erectile dysfunction. That's why adjusting your movements, avoiding positions that place excessive pressure, and using proper lubrication are all essential. Lubricants aren't just for added pleasure, they help reduce friction, which is a common cause of tissue injury. Also, if you or your partner notice changes like dryness, decreased sensation, or reduced arousal, don't rush to blame each other. Stress, hormonal imbalances, certain medications, or mental fatigue can all impact the body's sexual response. And now, as we continue exploring factors that affect the genital area, there's a silent culprit that many people ignore: heat. In the next section, I'll help you understand why high temperatures can lower testosterone and gradually impair your reproductive function. 6. High temperature. The invisible enemy of male hormones and sexual function. The fact that testicles are located outside of the body is no coincidence. The male body is designed so that the genital area stays slightly cooler than core body temperature. This allows optimal sperm production and proper regulation of male hormones. However, many modern habits, such as sitting for long hours with a laptop on your lap, taking prolonged hot showers, using heated car seats, or keeping your phone in the front pants pocket, silently and continuously raise the temperature in this sensitive area. Medical research has shown that elevated temperatures in the male genital area can reduce sperm count and affect their shape and motility. Not only that, high temperature can also inhibit enzymes involved in sperm production, which indirectly affects testosterone levels in the body. So, if you're regularly exposed to heat sources for extended periods, take proactive steps to adjust your lifestyle. Avoid placing laptops directly on your lap. Limit the use of heated seats. Choose lightweight, breathable clothing, and prioritize moisture-wicking materials, especially in hot weather or during physical activity. Caring for your genitals isn't just about hygiene or avoiding impact. It's also about being aware of environmental factors that seem harmless, but can slowly and persistently damage fertility and hormone health in men. But temperature isn't the only factor that can harm your manhood. In the next part, I'll talk about a very common habit that can easily rewire your body's natural sexual reflexes if done the wrong way. That habit is masturbation. Let's explore why something that seems so normal might dull sensation and disrupt your connection during real intimacy. 7. Incorrect masturbation. When your body learns the wrong kind of pleasure. When masturbation is done with excessive force or in a repetitive way that doesn't resemble real-life experiences, you may unknowingly train your body to react only to unnatural stimulation. In medical terms, this phenomenon is known as death grip, meaning the genital area gradually loses sensitivity due to years of overly intense pressure and speed. Many men after middle age report that they're still able to stimulate themselves effectively, but can't feel the same level of arousal when with their partner. The problem doesn't lie with the partner. It lies in how the body has been programmed by years of incorrect self-stimulation. The solution isn't to stop masturbating entirely, but to change how it's done. Try using lubricants to reduce friction, ease up on the grip, and slow down the pace. This will help retrain your natural sensitivity and make your penis more responsive to a variety of sensations, more like what happens during actual intimacy. And while using proper technique during masturbation is important, there's another factor that has a deeper impact on erectile function. one that few people think about: smoking. In the next section, I'll explain how nicotine damages the blood vessels, not just in your heart, but in the place where men need them most. 8. Quit smoking and build a positive lifestyle. A solid foundation for male sexual health. Among the many factors that lead to sexual decline, smoking is one of the most obvious and dangerous culprits. Smoking damages the endothelium, the inner lining of blood vessels, which plays a crucial role in delivering blood to erectile tissue. When this function weakens, the ability to achieve and maintain an erection significantly decreases. But it doesn't stop there. Nicotine also promotes arterial hardening, which reduces blood flow throughout the entire body, including the penis. Long-term smokers also face a higher risk of developing bladder cancer, one of the fastest progressing malignancies that is often diagnosed late and difficult to treat effectively. Beyond cigarettes, factors such as a diet high in unhealthy fats, sedentary lifestyle, chronic sleep deprivation, and substance abuse like alcohol or drugs also negatively affect male hormone levels. To improve and protect your sexual health, you should maintain regular physical activity. Eat a balanced diet, reduce stress, and ensure deep, restful sleep. Light exercises such as brisk walking, cycling, or swimming help improve blood circulation. Meanwhile, resistance training like moderate weightlifting can naturally stimulate testosterone production and help regulate insulin, two key components for maintaining long-term male health. No matter how committed you are to living healthily, there's one often overlooked factor that directly affects your sexual performance: your mindset. In the next part, I'll explain why anxiety, stress, and self-doubt can quietly destroy your ability to connect, feel pleasure, and experience satisfaction in your intimate life. 9. Don't blame yourself for sexual problems. Your worth isn't defined by what happens in bed. One thing I always remind my male patients is this: your sexual performance does not define you. Many men tend to tie their self-confidence and self-worth to their sexual prowess. And when things don't go as expected, it's easy to fall into self-doubt, disappointment, and even anxiety, to the point of avoiding intimacy altogether. But here's the truth. Male sexual function isn't a simple on-off switch. It's governed by countless factors, from hormones, nervous system, blood flow, sleep quality, and emotional state, to the dynamics in your personal relationships. Any imbalance in these areas can impact performance in the bedroom. What's dangerous is this: when you become too anxious, you unconsciously create a psychological loop. The more pressure you feel, the harder it is to perform. And next time, you feel even less confident. To break this cycle, sometimes you don't need medication, just a more compassionate perspective and someone who understands, maybe a doctor or a trusted friend. Not being perfect is completely normal. You are human, not a machine. Being able to listen to your body and proactively seek solutions is the true mark of strength. And once you're ready to take charge of your mind and body, there's one important biological principle you need to understand. If you don't use your erection regularly, your body might gradually forget how to do it. 10. Use it or lose it. Why maintaining sexual activity protects your natural function. One of the most important mechanisms for keeping healthy erectile function is to continue using it regularly. When a man stops engaging in sexual activity for a long time due to stress, illness, or distance in the relationship, blood flow to the penis gradually decreases. The result is that erectile tissue can become oxygen deprived, leading to fibrosis, reduced elasticity, and a gradual loss of erectile response. In fact, spontaneous erections at night or upon waking are a natural maintenance mechanism that the body uses to protect the sexual tissue. If these reflexes completely disappear, it could be an early warning sign of declining hormones or blood circulation. Whether you have a partner or not, maintaining a healthy level of sexual activity, including healthy masturbation, is still essential. Even when orgasm isn't reached, the process still promotes blood circulation, increases oxygen to the tissues, and keeps the penis sensitive to stimulation. And if you're looking for a safe, gentle way to support blood circulation and erectile function, I have a natural suggestion that many men trust: a supplement made from watermelon extract, rich in l-citrulline, an amino acid that helps increase nitric oxide production, thereby improving blood flow to the genitals without the need for prescription drugs. Let's take a closer look at this solution right now. Part 2: a natural solution to improve blood flow and support male sexual function. If you're searching for a natural, safe, and drug-free way to improve erectile ability, a promising option is a supplement made from watermelon extract, a familiar fruit with powerful biological benefits. Watermelon contains a high amount of l-citrulline, an amino acid that converts into nitric oxide, a compound that dilates blood vessels and boosts circulation, especially to the genital area. What's notable about this product is that it contains no stimulants, does not cause sudden spikes in blood pressure, and is ideal for men who want to restore their sexual health in a sustainable, long-term way. Many users have reported firmer erections, longer-lasting performance, and most importantly, a return of confidence in intimate moments after just a few weeks of regular use. Of course, no solution is truly effective if separated from a healthy lifestyle. When you combine this supplement with a smart diet, regular physical activity, and a positive mindset, the improvement in sexual function becomes much clearer and more sustainable. Right below this video, in the description or pinned comment, I've included a link to the product I personally recommend. You can check it out to see if this might be a good fit for your needs and condition. Dear friend, sexual function is not just a biological response. It's tied to self-worth, connection, and the overall quality of life for a man, at any age. Taking care of your sexual health is nothing to be ashamed of. In fact, it's a way of showing respect for yourself and for your partner. If you've stayed with this video until now, I believe you're truly serious about protecting your health. I hope today's sharing has given you a clearer, more complete perspective and enough motivation to begin or continue your journey of maintaining masculine vitality. If you found this content helpful, don't forget to subscribe to the channel and turn on the notification bell to stay with me in future videos on health, sexuality, and proactive aging. That's the easiest way to make sure you never miss out on scientific, practical, and easy-to-apply knowledge. Thank you so much for watching all the way to the end. Wishing you strength, good health, and happiness as you take charge of your life. See you again in the next episode.